My name is Fiona and I head up the Deckhand and Bosun department at YPI CREW. I'm joined today by Dr. Simon Gordon, who conducts the ENG1 medicals for Seafarers. He's going to answer some questions to help crew better understand what to expect from their medical. So, first up, what is Seafarers Medical Certificate and how does the ENG1 fit into that?
Right, so Seafarers Medical Certificate is there to check that you're in good health, both for yourself and for the rest of the crew and the guests as the vessel as a whole. Because obviously there's risks when you're going out at sea and you don't have medical care nearby. There's an international law that defines what are the standards that people need to meet. And the ENG1 is the British application of those standards. So the ENG1 is a medical exam which involves the doctor taking your medical history, examining your eyes, examining your hearing, and doing a physical examination, and then deciding what roles you can do at sea.
So if I wear glasses, for example, would I pass or fail?
So it's not really an issue of pass or fail. If your eyesight is good enough, you can do any role with glasses, with contacts on a yacht. But it's a question of whether you work on deck or not. The main issue is deck. And on deck, you need to have very good vision to be able to see what's happening and to do watch. So that's the issue to do with glasses and vision.
Okay. And if I'm colourblind and I want to work on deck?
So you can work on deck if you're colourblind, but you're not allowed to do night watch.
Understood. How about hearing? How strict are the tests?
The hearing test can be done in two ways. It can be done by a formal audiogram, but I think most commonly people do a version of what's called a WHO test. And what you do is you listen to some headphones and you hear numbers being called out with noise in the background, and you just type the numbers into usually a mobile phone, and it gets more and more difficult. I would say it's always impossible. Every time I do an ENG1, some people look like they're panicking because some of it they can't get, and then you get a mark. You can go onto the internet, and we could put a link into this post with the test, and you can test it yourself. Most people get through.
Great. Is BMI something that you are required to examine?
Yes, weight is important. Your BMI is very important, and there are various criteria to do with BMI. People who have a body mass index of over 35 are meant to be doing an exercise test to see that they're physically capable. The risk is about what happens in an emergency. Okay, BMI 30 to 35, it's really up to the medical examiner himself to decide what to do. The issue is whether someone is mobile enough and can act in an emergency.
Okay. What is a restricted ENG1 medical?
So some people have different medical problems. Different yachts do different things, different vessels do different things. You've got to remember that the ENG1 is not just for yachts, it's for lots of different types. So for example, if you're a fisherman in the UK, just going out for a few hours every day, that's very difficult or different from somebody who's on a yacht who has to maybe cross the Atlantic. So according to what's going on, we may restrict people's roles. I think the other issue is to think about what's called the time restriction. So to safeguard somebody's health, the ENG1 doctor may want to see you again within a certain time frame. 2 years is a long time, and sometimes that can be restricted. For example, I saw somebody today and I decided to restrict, time limit it for 6 months because I wanted to ensure that their medical problems were being treated properly.
Would that happen in the case if somebody had diabetes, for example? Or?
So if I met somebody who had new diabetes, I might time limit it to make sure that they know how to control it and they don't have any problems going forward. and then once it's well controlled, we may not time limit it at all. The idea is to create safety both for them and for everyone else on the vessel.
Are there any prescription medications that could affect a crew member getting
An ENG1?
ENG1?
Yes, we need to think very carefully about what effects medicines might have on people. And the other issue is how medicines are stored. So we need to think about how medicines are stored. It depends on how long the vessel is going for. Sometimes we mentioned restrictions. We might create a restriction to do with the medicine that they're taking. So it's very much a case-by-case approach.
And lastly, is there any top advice you have for someone who's a bit worried about doing their medical?
First of all, most people are young people who we're talking about yachting. They're in good health. They don't need to worry about it too much. If you do have medical problems, the issue is to be honest and to bring all the medical information with you so the doctor can make the decision on the day. I think before you do your ENG1, it's very important to get your vision checked. And if you're interested in doing stuff on deck, I also think it's worth maybe just making sure what your colour vision is like before you start the test. The final thing actually is to think about going to see the dentist. We actually fail people because of bad teeth, and it's one of the more common reasons that people get taken off boats. So I would also suggest going to see the dentist and going to see the optician before every ENG1.
Excellent. Thank you very much, Dr. Gordon.
Pleasure.